Okay, so how old are you?
35.
35. And tell me why you're here.
I'm here because I'm starting to see some early signs of aging that really want to get in front of.
I started seeing some signs of aging that you don't like because it looks like somebody in your family.
That's right. Love my dad, but yeah, it's cute for him, not for me. Yeah.
So tell me what you're seeing.
I'm seeing a couple of things. Jowling around sort of my jawline and face. So cheeks really kind of pulling down, not a clean jawline in profile.
As we get older, the gels develop, things fall down, and then your face become more square rather than V. So we're really establish that V shape, right?
Yeah. This guy under here.
This wall.
Yep.
What else?
Moving up, I've got a sort of separation here that's been with me for a while. I've tried filler, and that line, it just makes it worse.
Okay. So there's a little bit of a shadow, like right here. So it's sort of a malar groove, something we call that malar groove. You have a little bit of that, so that's something that bothers you, right? Okay. So you told me about the shape of your face. You told me you have some asymmetry in the brow, right? So the left brow of yours is lower than the right. It's primarily because this bone is a little bit more prominent on this side. So this brow sits a little bit lower. Your right eye is actually a little bit bigger than the left eye. And the right side of the face is actually larger than the left side. And this asymmetry is normal for human faces. So okay, so here's our plan. You were telling me that you feel like your eyes are deep set. This will open up the eyes very nicely. The other thing is I usually put some brow, volume underneath there, but you don't need any volume there, which is very different than most people because your brow bone is very prominent. So we're not gonna need that. Okay, so your cheek has that separation as you said. So we're gonna pick up the cheek, that's not gonna be a problem. We're gonna pinch a little skin underneath to enlarge the area, that's not a problem. And then you want the eyes to be turned a little bit like KO eyes. And there's like mild, medium, and dramatic, right? So I think we'll do like a medium thing. I think it'll be pretty. It will be very pretty. The eyes is everything. We build everything on the eyes, okay? And of course the jowls, it's pretty standard, the neck, it's pretty standard, the V-shaped face, okay? So the funny thing is, when I think about the face, from here on down, the lower face and neck is pretty much straightforward. The intricacies of it, I mean, everybody agrees what a young neck looks like. Long, skinny, and tight. That's what everybody wants. It's pretty universal. But when it comes to the upper 2/3 of the face, the cheek, volume, the brow position, the shape of the eyes, that's more artistic. That's more of a personal preference. Okay, so we are 10 weeks out for a Ponytail Lift, the Kale Luna lift, right?
10 weeks.
So tell me what people say when they see you.
Well, I haven't told very many people, but my sister and close friend, they just say it's supernatural, that I look like myself, but can't really tell what's different. Everything's just a little refreshed.
So yeah, that's what you came to me for, right? Because you were already pretty and on the younger side, but you kind of wanted to do something because you were genetically you felt like your neck was really beautiful.
Yeah, I mean, we have that fleshy, blushy Norwegian, Scandinavian sort of thing, which is not great, as you age. It's just a lot of laxity and jowling, and it wasn't something that I felt like was going to be a filler or a quick fix kind of in that way. And this was the answer.
Wow, this looks really good back here.
Super crisp.
It's looking good. I love your lip. That's a special one.
Yeah, that looks great.